The final question is that each of you have had a fairly long career, probably as long as mine now. And after this entire year of practicing medicine, what do you believe will become the greatest advance in healthcare to improve the overall quality of life? And I'm going to have Dr. Gordon start first.
That's a great question. And one that deserves a lot of introspection. I think it's a loaded question, actually, now that I think about it, because of COVID and vaccines and everything. Historically, as you know, vaccines have saved more lives than any other medical intervention that we've done, including all the antibiotic use, including surgery, including screening for cancer. Vaccines by far have saved more lives. Only clean water and sanitation have prevented more deaths than vaccines. Every year, vaccines across the world for either diarrheal illnesses, cholera, measles, pneumonia, polio, whooping cough, saves 2, 3, 4 million lives every year. This year, it's going to be 10 times or 20 times that, I hope, because of the COVID vaccine. But vaccines are a huge way that we can save lives. And we, right now, are in the midst of a huge technological jump. The technology associated with these mRNA vaccines, it's, first of all, to understand it, it's just fascinating stuff. What they do is they get a little piece of mRNA, which is a piece of what they call nucleic acid, and it codes for your body to get your body to make a little protein. And the little protein can do all kinds of neat stuff. With regard to the vaccine, it makes a protein that looks like a little tiny piece of that spike protein, so your body can say, that's a bad protein to have. I'm going to develop a big immune response to it and protect you from getting COVID. Okay, but this technology has been going on since the 90s. And the problem was this mRNA is very unstable. It only would live in somebody in a test tube for a very short period of time, so they couldn't produce it and then get it into people's arms in a timely fashion to make it effective. So this was something that was worked on for years and years. A group out of University of Pennsylvania was working on this, and they did some experiments in mice many years ago that found that it was highly effective. But the technology, this and together with another technology called CRISPR, where they take a little DNA from bacteria, those technologies are just so potentially open to innovation that they can be used to treat cancer. They can be used to treat, cure herpes infections, prevent malaria. We've been looking for a vaccine for malaria ever since I can ever remember, and we haven't come close. This technology can do something like that. We're going to get flu vaccines that instead of being 20, 30, 40% effective, might be 80, 90, 95% effective. Innovative treatments for sickle cell disease, HIV. So my opinion, at least in my lifetime, is I think this vaccination we're going to go through with this mRNA technology and CRISPR technology, which is associated with it, we're going to go and enter a new area of very fertile research and development of new drugs and therapeutics.